Well, in your capacity as a congressman, have you had some specific accomplishments regarding education and health or investment for the state of South Carolina that you could talk about?
Well, we do that continually. They're called earmarks, and some of them are pretty indefensible. I don't think any of mine is indefensible. We do lots of things at building infrastructure and improving education and improving local services for South Carolinians. In many cases, I'm helping out the small towns in my district. 5th District of South Carolina has 14 counties in it, and most of the counties are small counties, rural to some extent, and have small towns. They don't have the back office plans development, brochuremanship to put together massive grants to take down some of the funds that are available under federal program. So earmarks make up for the fact that they don't have the capacity otherwise to take advantage of programs that are for cities and towns just like these that I represent. And consequently, I can help them get money for a community health care center. That's been a real success story. I can help them get money for water towers and water lines and sewer lines that will bring new industry there. And if it weren't for the part that I play in trying to get some of that money, not huge amounts, but some of it diverted to South Carolina, our towns would not have grown nearly as much as they have. It pays off. It works out, and it's something I enjoy doing because it's helping the people that I represent and admire and respect.
Well, in Muskegon County, we have a very diverse community, and we're in that under 50,000 range. We were recently cited as being one of the highest unemployment in that range of towns under 50,000. And all along West Michigan, we have a wonderful rural community, very rich and abundant in fruit and vegetable production. And do you think we'll see in this coming Congress an increase in the Community Reinvestment Act or some of the proposals that can help to provide funding for not just infrastructure, but helping the communities rebuild themselves?
Well, as we talk, we're putting together a so-called stimulus package to try to put some lifeblood back into this slumping economy of ours. And a large part of that stimulus package, probably a third, maybe a fourth, will be for infrastructure. And a fair amount of it will be directed towards rural areas. The Rural Development Administration of the Department of Agriculture will benefit fairly well from this program, and that means they'll have community facility money to loan and to grant as grants, and that'll come to the benefit. I just had the second largest city in my district this morning from Sumter, South Carolina. They wanted to know what's in the bill that we can take advantage of, and I said as soon as we get the bill language, we will take it apart and we'll find out what you would necessarily probably qualify for, and we'll give you an opportunity. We'll let you know so that you can get to the front of the line and try to get this money. That's a big part of my job. But at least a third of this job is helping your constituents. A significant part of it is helping municipalities and nonprofit corporations that do business in the district. And of course, a significant part is legislation itself.
Well, and as one of the committee leaders, isn't it also your responsibility to make sure that the money is well spent and making sure that we're trying to take all issues into consideration? It's
absolutely one of my quests and desires, and it always stings when you find out after voting for something that contains something that you didn't support, believe in, or think was a good investment. But it happens in this big, complex institution. On the whole, I think we do good work, but there are times when our work is not as good as it should be. But I'm proud of the fact that we've been able to get defensible projects for South Carolina in the different appropriation bills that passed, and I think they've made a difference.
Well, in our area in Western Michigan, we're quite known for our fishing and our outdoor sports and hunting and other things like that. Do you have any personal things that you enjoy doing at that?
I don't have much time for that, but one of the things we have been able to do, for example, is to get money up and down the Catawba Valley to preserve some virgin timber and some fresh flowing water, and much of the land between Great Falls and Camden we're about to acquire through money that we were able to obtain along with state funds supplementing it. And it's great to see those beautiful parts of South Carolina, which are good for wildlife, good for hunting, good for fishing, preserved in their natural state. If we didn't do something like that, they'd be taken up in development in short order.
Well, I really appreciate your time. Is there any other comments you'd like to recommend in terms of what you look forward to in this next Congress?
We have some tough problems confronting this country. The economy is in the worst condition it's been in since the Second World War. Part of the problem is this is a recession unlike any we've ever seen before. It's not your typical garden variety recession. It's a recession that is brought on partly by the failure, the collapse of our credit institutions, rising out of the whole problem of subprime mortgages, but having now spread beyond that. We are, in this Congress, going to be confronted with that from day one, and we're going to have an answer for it on day two. I'll have to be honest with you and tell you we're sort of stabbing in the dark because there are no solutions on the shelf to go to and take down and apply in this given situation. We're doing a lot of improvisation in order to come up with ways to boost the economy for the long run. I am very concerned about the amount of debt that we're accumulating. We have had to incur quite a few debts just to fund obligations we've undertaken to help institutions that are critical to the economy from failing and bringing the economy down with it. But nevertheless, there's a limit to which we can't go, a limit beyond which we can't easily borrow. And I don't think we're there yet, but we know we're approaching some of those limits, and one of these days that limit could, if it were ever struck, could have severe consequences for us. So we are forewarned, and we should be doing things now to make sure that debt accumulation is kept to a minimum. Once we get the economy back on its feet, we've got to deal with the long-term solvency of Social Security, Medicare, and Medicaid, the three major entitlements in our budget, because over the long run, down a path that is truly not sustainable. They're great programs, some of the most significant achievements we've made as a people, really crowning accomplishments, but nevertheless, we've got to keep them in an affordable condition.
Do you think we'll see some incentives and ways to reduce the health care costs that are affecting many working class and lower income people, so that there is some sort of safety net, maybe if not national health care, some way that we can better manage the funds so that we're getting better bang for our dollar?
Whatever we do, cost reduction has to be front and center, a major part of the effort. Some of this is sort of subtle, such as the Obama administration's reliance upon and concentration upon information technology. You wouldn't necessarily associate the two, but there's a strong belief that if we could get some interoperable software and hardware that covers our whole medical system, all providers, physicians, hospitals, and others, that it would make the delivery of health care far more efficient, the cost of it much more reasonable, and that is the sort of thing that we're probably going to need to fund at the national level, or else it'll be a long time funding itself, as small physicians groups simply don't find it cost effective to take on the development of software like that.
Do you think that we'll be able to see some changes that will allow veterans to be able to access local medical facilities and even their local pharmacies so they can get direct care, instead of having in some areas our constituents have to go 150 miles sometimes to go see a doctor to get their appointments, and it's very stressful on families?
Well, we do have a triple option prescription drug provision right now, and we have more veterans outpatient clinics than ever before. The Veterans Administration says, let us take the patients within our system and treat them within our system, as opposed to having some kind of dual system where some are treated outside and some are treated inside it. They like to keep everything within the system, which is the largest healthcare delivery system in the country. And the way they have been implementing that objective over the last 10 years is by building these outpatient clinics, and they've been very effective and very popular where we live.
Well, thank you, Congressman Spratt, for being one of our leaders in Congress, and I appreciate your time, and good luck to you in the years ahead.
And all the best to the folks in Western Michigan.
Thank you very much. And thank you for joining us on Where Do We Go From Here?